and welcome back to Dr. Patel. So I am Dr. Patel. So for those who don't know me, I am a pediatrician, a NICU doc, lactation/breastfeeding specialist. I'm a mom of 4 boys, married to my college sweetheart, and also the owner and founder of Naya Care, a home health company that specializes just in the 4th trimester. And all of that is really important because it has molded my career and where the platform that I stand on now, talking about maternal mortality, talking about the risks of it, and how it really is the center of our economy. So let's dive into it. This video is going to be talking about the actual risk of raising children in the United States. The other disclaimer I do want to point out is that this is not a political video. I don't care if you're Republican or Democrat. The way I look at issues personally is outcome driven. Like, what do I want as an outcome? Why am I not getting that? And now let's look at data to figure out how to achieve that outcome. So, for example, the outcome that I'm looking for, and I think most Americans look for, is I want a healthy family. A family is core to our communities and our society. So I want a healthy family. Now, what are the barriers? That there's articles all over the news that are saying that, the cost of children is going higher. It's deadlier in the United States to raise children. Like, what is going on with that? Again, we look at outcomes, then we go back and say, hey, where is the data to help us achieve those outcomes? So again, this is not political. This is not looking at it from a lens of a politician. So if that's how you would like to look at big issues, then come join. Again, let's look at outcomes. Going back to what drove me to do this video. The Atlantic published this article, turn of the new year in January, and said, you know what, it is super deadly to have kids here. Then when I went to the conservative media, they're like pushing on family. And this idea of, the family unit is a mom and a father. Father figures, mother figures are important core for that child to flourish. Okay, both things are kind of saying somewhat the same things, but the outcome, we want in the United States of America to have the ability to raise children without risks, and to then, as the outcome, allow them to flourish so we can invest in our communities and society, and in turn that creates citizens of this great country that can push the economy for everyone, right? That's what everyone is saying. That's the outcome we're looking for. We want healthy families, right? That's all we all agree on. We want healthy families. Now, let's break it down to see what is it that is preventing us as Americans to not achieve that healthy family, and why are there articles being written that it is super deadly to raise children in the United States or to have kids in the United States. So let's start from the aspect of the mom, the one that is creating these children, right? One of the things that I talk about and bring light to over and over again is the maternal mortality crisis that we're having here in the United States. Maternal mortality is a ratio, and it represents women's death when they are pregnancy, birth, and post-birth. Maternal mortality, it was established in the early 19th century with the WHO, the World Health Organization, to look at barometers of a society's economical and societal and happiness and financial and all that lovely jazz, and seeing how well that society is doing as a 360. Maternal mortality is key because, again, when you look at research, so again, going back to data driven, there's no opinions here, it is research driven, that the mother, she really is the unit that allows, she is the key part of that unit that allows the flourishment of infants, children, and adolescents. I'm going to go down this hole and be like, why is that? And a couple of key points is, one of the biggest ones over and over again is universal health care. Again, this is not political. This is data driven. So what does universal health care mean? Universal health care means access to prenatal care. Quality prenatal care. When you have access to health care, it's more prevention of things that might not go right. And then when you are preventing those things, then yay, we can actually intervene and say, okay, you know what, you actually have gestational diabetes and you got tested for it appropriately. Now let's take it, because it's not only a risk for you as the pregnant woman, but also the babies. Those babies can end up in the ICU when they're born due to being exposed to too much glucose in utero. So let's take care of this. Prenatal care. You're having high blood pressure. You didn't even know that you had high blood pressure in the beginning of pregnancy, and now it's continuing to get higher and higher because that's what pregnancy does, and there's a whole physiology behind it. We're not going to go into a medical lecture about it, but it's actually kind of fun. So all of those things, and now you have high blood pressure, and we know that is a risk for your health and your baby's health. So let's help prevent that, right? So everything is about prevention. Everything goes back to prevention. And how do you help with prevention? You create universal access. So it doesn't matter if you are an African American woman, an indigenous mother, or a Caucasian, Asian, name it, you actually have good access to prenatal care, and that's where it starts. Other countries that do this, if you look at their data and you look at, the maternal mortality, they're super, super low. And one of the biggest differences is there was actually a study that, really took away all the other parameters, took away, okay, there's, we in the United States are actually an unhealthier country with, exposure to more derivatives and stuff in our food that's not healthy for us. European countries usually don't do that. They're much more regulated. So we have increased obesity, increased BMIs, maybe an increased risk of C-section. So this particular study really took all those factors apart and said, okay, what is the true difference? Okay, despite all of these associated factors, what is the true difference? And the true difference was our healthcare system. So how do I know all this? Okay, so total plug here, plug coming up. That's my book, guys. The Doctor and Her Black Bag. It took me a lot to research this, and the study's actually published in here, and the link is there too, so for anyone to do. So we're talking about maternal mortality, right? That's what we're talking about. So that outcome needs a medical intervention. Now we look at maternal mortality again and say, okay, now when we break down that data, we notice that a lot of women who are 40 and above are at the higher risk of dying. Our data is showing that. We know it is with birth control, with IVF, we've allowed women to dictate their reproduction, which is, again, that's not, I'm not going to be like commenting on that opinion, because it is not my job to dictate what someone else does. My job is, okay, so here's the data showing that women who are 40 and above have higher risk. When we say that, those women might be first-time mamas, or they might be second and third-time mamas, and when they die, they're leaving their older kids behind as well. And so the ramifications become that solid unit is going away. Now, let's take maternal mortality and say, okay, how does this affect the family? First of all, this death is unexpected, right? You don't go into pregnancy thinking that, hey, I'm going to die. You don't have a baby shower and showering women and saying, oh, by the way, there's a risk of, like, that doesn't happen. These deaths are unexpected. And unexpected deaths leads to economical cost of burden. So immediately funeral cost, okay? Secondary, so again, if there are, the mother has passed away and left other older children, now there's a scramble of, okay, what's gonna happen to those children? The partner who is there, the family unit that has already been established, well, all the dynamic changes, you know, and on a granular level, it's like, I know as a mom, I do a lot of organization, and here's a schedule, and oh, I can go take this person here, or I'm going to take this person here, and all of that would go away, right? So we forget that it's on a granular level too, like simple things as, okay, making sure all the groceries are done so we have lunches and we have healthy food for dinners. What are the dinner plans, right? Despite how far we've come, we still have your traditional roles. And yes, some families do a better job of being collaborators, but some families are back to the traditional roles. And there's nothing wrong with it, guys. Like, everybody wants everything to be political. There's nothing wrong with it. Sometimes in a relationship, you know, some partners can give more than others in certain areas. And if you look at family as a unit and say, hey, these are the things that, you know, we need to have financial security, economical security, and that we need someone to be there taking care of the kiddos on, you know, like, okay, make sure their laundry is done, make sure all of that, and someone has to oversee that. And as partners, you kind of decide who's going to do what's going to happen, where the jobs are. And sometimes, you know, in certain periods of life, sometimes the mother takes on more burden, and sometimes the father takes on more burden, and whatever your family unit looks like. So again, we're not going to political part of this. It is what it is in some things, but the point is that that stuff gets gone, right? It's that mother also who joins the PTA, knows what's going on. For me, for example, I actually coach basketball. I coach my son's basketball. I've been coaching since he's been in the 4th grade. And I do this because I want to do it, right? And lastly, bonding, right? The bonding goes away. You need that mother for all of that. So not an opinion again. So if you go look back at data, what it shows that there's an economical burden immediately, and then the ramifications of the mom unit being gone, really does, it is a burden for the development of that infant, that child, other children. And then when you're looking at which children are affected more, it usually is the girls, because they take upon more of the motherly duties. Sometimes their educations are stifled in countries that are particularly second and third world countries. They are also married earlier, and then they have kids earlier. So as you can see, it's tumbling, right? It's just not affecting now. It's affecting our future generations. So that's maternal mortality, somewhat in a nutshell. Again, totally promoting it. Get it. It's really good. It's free on our website, and it's a 5-hour Audible. So going back to, okay, our outcome is we're looking at a good family unit. So we talked about maternal mortality, and now let's talk about what is with that family unit. So early childhood. Early childhood is very important. A lot of more experts have talked about this, and I'll kind of link some of the stuff down there. Early childhood development is key to fostering a generation that is great citizens and educated citizens, and citizens that can continue this great country of ours, right? That's what we all want, is the next generation to do better than we are, and to continue this ideology of what the founding fathers established. But when you look at early childhood, there is so much burden on families. And sometimes it becomes political because where's that burden? Who's going to take upon that burden? Some people say it's you made the decision to have the child, so you should be taking that burden. Some people say, no, we as a society, because we want a healthier, educated society, we should help with some of these burdens. Okay, boom. Two sides of the spectrum. Let's look at the data. The data, again, shows if our society supports early childhood with reduced childcare fees, universal kindergarten, all of that, it really adds to the flourishment of that child. It adds to the stabilization of that family unit. It creates parties that are going back into the workforce, have less stress, then they can become more better workers. So there is a lot, again, data driven, there is a lot of emphasis on if we can support early childhood in terms of free universal kindergarten, reduced preschool rates, daycare is kind of covered, childcare is covered, and the biggest thing with all of this is paid family leave. Okay, so if you watched my videos before, I'm a big proponent of universal paid family leave. Paid family leave has so many benefits, and I'll link my video for that. And also on the employer side, it is not a burden. It's actually shown that on the employer side, to replace that worker, it's 21% of that worker's annual salary. And I'm actually quoting quotes that are in 2018, 2017. With the economy, it can change, but there is a fraction. So the underlining message is there is a fraction of cost it takes versus just giving universal paid family leave. And on top of that, if you give universal paternal leave as well, bonding increases. The father figure is important in the family unit, but allowing that father to have the time with their child, right? It's not this like, oh, okay, now I got to have all these other stresses that dads have, that we kind of just being like, oh, you're just a man, you got to do it. But that's not fair. And again, when we look at data, it says, especially data where paternal, so father taking leaves, was one study from the UK showed there's 19% increasing of their involvement in their child rearing, which is important because the outcome we're looking for is a stabilization of the family. So paid family leave really does play a huge role in it. And side note, the United States is one of the two countries to not offer universal paid family leave. I live in Colorado. We've just started enacting the Colorado paid and medical leave. We are the first state as of this recording that does medical leave as well. So we talked about maternal mortality and the risk of it. We talked about, early childhood with the universal and reduced care for child care. We talked about paid family leave. And now let's look at what happens to kids when they go to school. And one of the biggest factors is gun violence. And gun violence is, as pediatricians, we talk about it. We talk about it with our families on an individual level. And we come with this idea of, honestly, I don't care if you own a gun or not. Okay, that is not my opinion for you to own a gun. But I need to make sure that it's safe. I need to make sure that you are doing it safely. So those are the conversations that I have with my family. So it's like, okay, do you own a gun? Yes. Okay, so is it locked? Yes. Are the ammunitions in the gun put in two separate places? Because we know back to data to be like, oh, if we put the gun in one area that's physically away and we put the ammunitions in a different, it reduces the risk of gun violence and gun associated deaths that occur. So when we actually can look at data and we need outcomes, we can be like, okay, well, these are the things. Again, these are not opinions. These are data driven. And so that's why it's so important to do this research. It's so important to have this. So those are some of the key points of, okay, why is it so terrible? And why is the United States being ranked as the worst place to have kids? We talk about maternal mortality. We didn't even address infant mortality. Infant mortality is again on the rise, unfortunately. And it goes back to healthcare access for that and prenatal access that we've already talked about. When we talk about early childhood, we need to address the lack of paid family leave, the lack of universal kindergarten, childcare cost as well of this. And when we talk about children, we need to talk about gun violence. And lastly, when we talk about adolescents, we need to not only talk about drug abuse, vaping, and also mental health. And I love the state of Colorado I live in. For those who live here, I don't know if you guys know this, but the program is called imattercolorado.org. So imattercolorado.org. It is opened to any Coloradan school-age kids that are from 11 to 19. It is six free mental health visits with a licensed counselor. And the website is freaking amazing. I've actually used it for my kids because I want them to understand that when you have issues with mental health, it is normal. So they didn't go through the whole program because they were fine with it and it was on their decision. But each of my children has actually done the program because I just want that message to be that mental health is just important as your physical health. And they're all athletic, so it's easy for them when they like sprain an ankle, right? But then it's like when you sprain your heart and your brain, we need to take care of that as well. And it's okay to take care of that, and it's normalizing to take care of that. So those are the things that these articles are pointing out to why it is so hard to raise kids here. And if we break it down and we look at each stage properly, and then we identify, okay, well, here's the reason. So let's kind of identify how we can support that. At the end of the day, the family outcome that we all want are healthy, thriving families, because if we have healthy, thriving families, our societies and our communities flourish. And if our societies and communities, our neighborhood flourishes, America flourishes, right? The last thing, just to kind of somewhat wrap up this video, because I know there's a lot of conversation that can continue with this, is that I really implore you guys, especially in this time of political season, to really look at what outcomes and kind of go to start kind of thinking about, okay, when I vote or when I'm thinking about these things, I also need to look at it from a perspective of community, because if my community is thriving, I'm thriving. Simple thing as garbage collection, right? Or getting the post out. These are society means to create a society where all of us can thrive. And I'm not advocating for, okay, we need the government to step in for everything. No, that's not what I'm advocating for. What I'm advocating for is let's look at outcomes and let's pour our money, because we all pay taxes, right? But let's pour our money into issues and into solutions that will help benefit our society as a whole and continue to make America the most wonderful country to live in. All right, guys, thank you so much for listening. Thank you for joining me here. Love to hear your comments as well. Data-driven, please, data-driven, outcomes-driven. No political rhetoric on this channel. And have a great day. Until next time, this is Dr. Patel, Everything Fourth Trimester.